I want to talk today about knee joints and how we fix knee joints. Okay, the knee joint is a relatively simple joint. It's a big joint, so there's a lot of bone on bone, or a lot of surface area that touches between one bone and another. So it should be a very, very strong joint. However, it exists within this complex between the hip and the ankle and the foot that make it much more complex in how it works. So the muscles that are supporting the knee, many of the muscles that are supporting the knee are coming from quite far away. So that can add some challenges. Also the way that, I think probably even the way that we walk and the surfaces we walk on and types of shoes we wear, all of these things have an effect on us. So in order for our joints to work very well, our body has to be functioning at a very high level. So I'm going to talk a little bit about the types of things that go wrong with the knee joint and the ways that we approach fixing a knee joint. So one of the things to bear in mind again is that it's a very simple joint. It's just basically a hinge joint. There is some tolerance for what we would call translation, where your tibia can slide forward or backward. There's a small amount of tolerance for that. You don't want too much of that. If the tibia slides too far forward, you can blow your anterior cruciate, or reverse for the posterior. As well, there's a small tolerance for rotation in the knee, but we don't really like to see a lot of rotation, except when the knee goes fully into, becomes fully straight. There's a little bit of rotation there. But in the normal motion of the joint, we don't want to see a lot of rotation. So, let me just explain one of the things that very often happens. If we have too much rotation in the joint, very often we'll get irritation of the meniscus. Now, one of the most common things that I see is that the medial meniscus will be wearing out because of too much rotation. Now, one of the things that I think is most directly related to that is a muscle on the back of the knee called Popliteus. And if you're looking at a knee, it goes from your femur on the outside to the inside of your tibia. So if you're looking at someone from the back, it makes like a V shape. This one goes like this, and this one goes like this, the Popliteus. And what it does is it creates an internal rotation of the knee if it's contracting. Now, the only time that that muscle really should be contracting is to unlock the knee. Because if your knee is completely straight, the muscles that are going to bend your knee would be the muscles on the back of your thigh. So your hamstring muscles can contract to bend your leg. However, when your leg is completely straight, the hamstring muscles are very, very straight as well. They don't have any leverage. When they contract, all they would do is just pull the joint together. So you need a muscle on the back of the knee joint that just kind of gives it a little bit of an unlock. It unlocks it. So the Popliteus can contract to unlock the knee, and then as soon as your knee starts to bend a little bit, then your hamstrings have a mechanical capacity to bend your knee further. So one of the things that we'll commonly find is that when someone has a medial meniscus problem, we'll palpate the back of the knee and see the Popliteus is very, very tight. So that muscle, again, shouldn't be contracting really at all. It only contracts in that moment. So if it's contracting all the time, then it's always creating a rotational sort of torque in the knee. And that twist in the knee, as your knee is bending, if it's twisted and staying twisted as it's bending, that's going to start munching away at the meniscus. So obviously we don't want that Popliteus tension. What do we do about it? Is it just there for no reason? Now, your body puts Popliteus tension in there as a compensation. So compensations will happen when your body senses there's some instability. So instability in the knee is very, very common. And the Popliteus is contracting to try to balance out the lack of stability from other muscles. Now, the one that I find is one of the most key muscles for stabilizing the knee is the Tensor fasciae, which, if you know anything about the muscles, that's in your hip. But the Tensor fasciae attaches into the iliotibial band, and the iliotibial band attaches into the lateral knee. So the outside of your knee has this iliotibial band, which goes past the knee joint and into the into the lateral part of your lower leg. So what that's doing is that's going to help to stabilize the lateral knee. So I don't have any muscles to show you this with, but you have to follow my hands. So what it does is the tensor fasciae latae, when it contracts, is going to stabilize the lateral knee, and what it's going to do is it's going to limit the anterior translation of the knee, but it's also going to give you lateral stability. And if that starts to fail, your body's going to do two compensations. One is it's going to start contracting Popliteus, and the second is to contract rectus femoris. So the rectus femoris is one of the quadriceps muscles, and it's the only one of the quadriceps that crosses the hip joint as well. So the tensor fasciae latae crosses the hip and the knee joint, as does the rectus femoris. So your body is going to use rectus femoris to make up for the fact that tensor fasciae latae is weak. So it's not a perfect solution because rectus femoris is meant to extend the knee. So what it does is it's pulling against the top of your kneecap to try to extend the knee. So if it's contracting all the time to try to stabilize the knee, what it's going to be doing is putting a lot of pressure on the kneecap. So a lot of times people have subpatellar sort of swelling or swelling underneath their kneecap, or irritation underneath their kneecap, or even wear and tear underneath there, because that rectus femoris is contracting all the time and constantly putting a load on the top of the knee joint. So if we have a compensation because of a weak tensor fasciae latae, where there's rectus femoris tension, that's going to affect the patella, and the popliteus tension is going to try to stabilize the knee and this translation, but doesn't really do it very well either. But it's going to end up adding more rotational torque into the knee. So the two big muscles which are too tight would be popliteus and rectus femoris, and the main muscle that I often find is tensor fasciae latae. Now tensor fasciae latae on its own, if we were to say what does that muscle do, what it does is it brings the leg up and out to the side. So it would bring your leg forward and laterally out to the side. But we don't use that muscle in the concentric form. What we do is we use it eccentrically. So in other words, when we take a step forward, say from our left to our right, what happens is our body is going from back here on the left, we're propelling ourselves forward, stepping onto that right foot. But because there's a moment of left to right motion, when you land on that right foot, the mass of your body is still going to the right. So you need a muscle which is going to brake you to keep you from going further to the right. So tensor fasciae latae is a very powerful muscle for doing that. It stops you from continuing forward in that direction. So it works eccentrically. So in other words, your muscle will contract and lengthen at the same time. So it works as a bit of a brake. If it isn't working, one of the things we'll typically see is that the person will feel like their leg gives way. So in other words, their hip will drop, or they'll feel like they're standing still and they say, oh, my knee just gave way. But really what's happening is that tensor fasciae latae is failing to stabilize when they need it to. Another thing that will happen is tensor fasciae latae does have some concentric action in lifting your leg up. So people will sometimes say, if that's weak, that their leg feels really heavy going up the stairs. Or when they go downstairs and you're using that muscle eccentrically, so in other words, it's working as a brake as you're going down the stairs, your body is dropping onto that leg and you're relying on that hip stabilizer to stabilize your hip. If it's not working, what will happen is you won't have that hip stability or the knee stability, and you feel like your leg is just going to give way, or it may actually give way. So not having tensor fasciae latae strength is a very, very big issue. So what I'm describing here is basically one of the most common things that I see in knee problems. So whenever I'm examining any knee, obviously we're seeing how the joint is working, whether there's translation in the knee, how it's rotating, how it's flexing and extending. But also I'm palpating the joint to see if there's rectus femoris tension, whether there's popliteus tension, and whether there's weakness of the tensor fasciae latae. And if any of those three muscles are compensated, or or weak or tight or whatever, then we have to try to find out why that's happening. So that's not such a simple explanation, but the tensor fasciae latae is an extensor muscle. So extensors are more prone to failure, and we have to look at some of the mechanisms behind extensor failure. So in other words, if it's just that muscle, then it might be because of something else that's happening in the hip. Maybe there's some deep gluteal muscles that are tight that are turning that one off. Very often people have, sciatic pain or pain in the deep muscles at the back of their hip, which are the opposite muscles to the tensor fasciae latae. So if those muscles are tight, then you'll have a weakness of the tensor fasciae latae. So these sort of knee problems very often go along with sciatica as well, or sciatic distribution of pain, where there's pain in the back of the hip because of those deep gluteal muscles being too tight. Again, those muscles are flexors. Flexors and extensors work as an agonist and antagonist to each other. So we have to pay attention and look a little bit about whether there's just an overactive flexor muscle, which is making a weakness of the extensor, which is just at that area, which we could treat by treating the hip, or whether there's some other reason for that muscle to be the flexor muscles to be tight, or another reason for the extensor muscles to be weak. It could be some mechanical compromise in the lower back. It could be some compromise in the stability of the spine. So there's a lot of questions we have to ask, and then even beyond that, there's other consequences higher up in the brain, and how your brain is controlling and regulating the balance of flexors and extensors really on that whole side. So if I see a multi-joint weakness of extensor muscles, then we're looking at higher control centers. So it's not a very, very simple answer why we have knee pain, but there are lots of levels of things that need to be considered. So if you're a practitioner, I hope you find this helpful. If you're a knee pain sufferer, again, I hope you find this helpful. I'm not sure how much I'm trying to make it as easy to understand as possible. So if you have any comments, please leave them. I can give more information if you just tell me what you want to hear. But I hope that's a little bit informative for those of you that are suffering or treating knee injuries. Thanks for watching.